In the name of God, hello to all my friends and my greetings to all my friends and colleagues, healthcare professionals, and students and fans everywhere. This is Professor Dr. Tarek Ali. In this live streaming, I just want to confirm on what I have mentioned before in one of my online streamings or YouTube channel speeches before, that I have mentioned that and I have called out that the subject of the history of medicine, the subject of the history of medicine must be included in the curriculum of medical schools. This is, in my opinion, as an academic and as a professor of clinical medicine and as a clinical teacher over a long time, and with a lifelong history and experience in teaching medicine, especially as a clinician and as an academic in the medical science, the branch of clinical internal medicine. And I have mentioned before, and I have called out for including the subject of the history of medicine in the curriculum of medical schools or in the curriculum of the medical universities, at least in the preparatory years. This in the first year of medical education. The educational system, the medical educational system, must include this subject. And I have mentioned before that لو كان الأمر بإيدي كنت في مركز وزير أو مدير جامعة إن أنا أدخل ككادر طبي وكعضو هيئة تدريس جامعي في جامعة القاهرة سابقا وكأستاذ متفرغ في كلية طب جامعة القاهرة to include two important subjects actually اللي هم مش موجودين في مش عايز أقول في كل مدارس الطب في العالم اللي هم تاريخ الطب مادة تاريخ الطب. One subject is the history of medicine and another subject is the philosophy of medicine. دايما كنت بنادي ان يجب ادخال المادتين دول في التدريس في مناهج كليات الطب لرفع awareness of the medical students during their تحصيلهم العلمي and during their university years, studying medicine and studying medical sciences, that the subject of history of medicine and the subject of philosophy of medicine must be included in the curriculum, in the medical education curriculum, at least in the first year or the preparatory year, what we call the preparatory year. In the past, we call it إعدادي طب أو سنة أولى طب. They should study, the medical student should study the history of medicine and philosophy of medicine. And all those who are following me and my fans know that I always focus on the history of medicine and its importance in medical education and to be included in and to be part of the educational system and to be a subject included in the medical curriculum for medical students in the preparatory years. History of medicine and the philosophy of medicine. The philosophy of medicine order that the medical student must understand that the wisdom of medicine and the importance of wisdom in medical education and in medical practice and the importance of wisdom in clinical management and in clinical decision making. They can't be good, wise physicians and understanding physicians without studying and learning and understanding what is the philosophy of medicine and what's its relation to other philosophical sciences or philosophical branches like the philosophy of science and its relation to the philosophy of life. This is the importance of studying the philosophy of medicine. Of course, the philosophy of medicine أو مادة فلسفة الطب لا تدرس في كليات الطب، أو على حد علمي في أغلب كليات الطب في العالم لا تدرس هذه المادة. هم بتقرأ كمادة جانبية لما الطبيب بيصل إلى مرحلة معينة من الفقه والعلم والخبرة، أو بالصدفة بيطلع على إن في حاجة اسمها فلسفة الطب وبيقرأ في فلسفة الطب، لكن هي لا تدرس في ضمن العلوم الأساسية مع علم التشريح والفسيولوجي، أناتومي، فسيولوجي، بايوكيمستري، هيستولوجي، اللي هي بتدرس في السنوات الأولى، بالإضافة للباثولوجي والميكروبيولوجي والباراسيتولوجي والفارماكولوجي اللي بتدرس فيما بعد قبل تدريس العلوم الإكلينيكية زي الانترنال ميديسن جنرال سيرجري والجايني وكل العلوم الإكلينيكية اللي بيختم بيها طالب الطب دراسته في كليات الطب أو في الجامعات الطبية على مستوى العالم كله. فهنا مادة فلسفة الطب مهمة. كذلك مادة تاريخ الطب أنا بعتبره مهم جدا in that this medical student should study the history of medicine. Exactly like studying all my colleagues and students know that I am also not only a doctor, I am also a lawyer, لأن I have studied law and philosophy and jurisprudence أنا خريج كلية also شريعة والقانون في جامعة الأزهر، ودرست العلوم الدينية والفلسفية والقانونية، وبالتالي أفهم يعني إيه أهمية دراسة كما درسنا في كلية القانون والشريعة أهمية دراسة تاريخ القانون مثلا، اللي هو تاريخ القانون كان أحد المواد الرئيسية اللي أنا درستها في سنة أولى في كلية الشريعة والقانون، تاريخ القانون The History of Law. نفس الكلام يجب تطبيقه في الطب، إن يجب دراسة تاريخ الطب أو تدريس تاريخ الطب لطلبة كليات الطب. ليه؟ لأن التاريخ فيه دايما كده عندنا قاعدة يعني عارفينها كلنا، بنقول أن من لم يقرأ التاريخ، ده قالها الإمام محمد عبده، من لم يقرأ التاريخ فقد فقد ركنا من أركان اليقين. دراسة التاريخ مهمة جدا عشان تفهم إيه اللي بيحصل وليه حصل. حتى الكتب المقدسة فيها كثير من النصوص التاريخية، حتى القرآن الكريم تلته قصص يعني تاريخ، لأهمية دراسة التاريخ. وكذلك العهد القديم والعهد الجديد كله نصوص تروي تاريخ الأنبياء والملوك من سفر التكوين لسفر الخروج في العهد القديم اللي هو التناخ، مرورا بالأسفار الأخرى في أسفار الأنبياء والكتابات زي ما ذكرت قبل كده، بس مش عايز أدخل في مواضيع جانبية. لكن دراسة التاريخ مهمة جدا، قراءة التاريخ مهمة جدا، نحن نقرأ التاريخ مهم جدا علشان نتعلم حاجات كتير من التاريخ. يعني in the history of medicine لما أنا أقرأ تاريخ الطب لازم هنا it's very important to know how the pioneers in medicine and how the pioneers in the medical history and how the fathers of medicine throughout the different stages of life and throughout the different era and over the different era in the past, starting from the old civilizations زي في الحضارة الفرعونية القديمة, in the old Egyptian civilization and in the Greek civilization and in the Roman civilization and in the Chinese civilization, how did the doctors practice? How did the doctors and the physicians at this time practice the medicine? And how did they discover important discoveries and important inventions in the history of medicine? And how the discoveries and how the different discoveries and the inventions in the medical aspect of life or in medicine have happened. كيف تم الاكتشاف والاختراعات في and how the different diseases have been discovered. For example, how they discovered the importance of sterilization in medical practice and in human life. التطهير والتعقيم في التاريخ، في تاريخ الطب، زي مثلا العمليات الجراحية the different operations done in the old Egyptian civilization and the different procedures carried out by the old Egyptians in the old Egyptian history, especially that Imhotep was the father of medicine and the first pioneer doctor in the human history as a physician, and after him also Merit Betah, the first female and the head of the female physicians in the old Egyptian history, Merit Betah. وكذلك برضو هسيراع. And also the other eminent physicians in the Greek history, like Hippocrates, who is the father of Western medicine. How did Hippocrates contributed to the medical practice, and why he is the father of Western medicine, the Hippocrates and his famous oath for medical practitioners. And after that also the Greek physicians and the Roman physician like Galilius and like Galinos, and also after that in the Islamic history, the first physician and the famous physician who also contributed to the Eastern and Western medical civilization and medical teaching and the medical history, the Avicenna أو ابن سينا, Abu Ali ibn Sina, Avicenna, and how Avicenna was the first one who described the evidence-based medicine, and he put his book Al-Qanun fi al-Tibb, the law in medicine, and another book Al-Shifa, the cure or the treatment by Avicenna, and the repercussions of these scriptures, medical scriptures in the history of medicine, and its implications and its repercussions on the practice of medicine in the West and in the East after that. فهنا وكذلك the other physicians in the Islamic history like الرازي وأبو بكر الرازي و ابن الهيثم and ابن النفيس who discovered الدورة الدموية, who discovered the small circulation or the pulmonary circulation, and Ibn al-Nafis after and also Al-Hasan ibn al-Haytham, who has many writings in optics and in ophthalmology, and also Razi in clinical medicine and in clinical pharmacology, Abu Bakr al-Razi, and he is considered as one of the pioneers in pharmacology, Abu Bakr al-Razi, and also many other pioneers during the Islamic history, as mentioned, Al-Hasan ibn al-Haytham wa Ibn al-Nafis wa Ibn Sina, the great physician and the pioneer. And after that, we come to also the physicians in the Chinese history and Ifana, and then coming to the contemporary history and the great physicians in the 17th and starting from the 16th up to the 20th century. Galen, the great Italian physician who described, who was a famous Italian anatomist, and he described many anatomical structures. We all know the vein of Galen in anatomy in the brain. So Galen was a famous Italian, and also the other British physicians like Professor William Osler, who described the many clinical signs like Osler's sign, and he was considered the father of medicine in England in the 19th century, William Osler. And also René Laennec is a famous French physician, and he is the discoverer of, inventor of the stethoscope, which all doctors use, مخترع السماعة, René Laennec. And he described also, and he has many writings about liver cirrhosis, and we call it Laennec cirrhosis, and also in pulmonary tuberculosis. He described many things as a clinician, and he described the heart sounds. This is Professor Laennec, or his name is René Laennec. So Laennec, also his name is very famous in modern medicine as a French physician. And how did Cushing describe Cushing disease? How did Addison describe Addison's disease? How did Professor also Charcot, Jean-Martin Charcot, he is a French neurologist, famous and French neurologist, and he is the father of neurology. How did he describe the Charcot triad and the Charcot joints, the Charcot foot, the Charcot triad of and the Charcot arthropathy and Charcot, which is neuropathic joint. How did the Professor Jean-Martin Charcot, and اسمه شاركو مش شاركوت زي ما بعض الناس بتقولوا، ده الناس لازم تعرف لو فرنش تنطق فرنش صح، جيرمان تنطق جيرمان صح. بروفيسور بما اننا بنتكلم على جيرمان، فيركاو Rudolf Virchow. Virchow described Virchow triad in deep vein thrombosis, and he described the Virchow sign, Troisier sign, or Virchow's nodes, which is a very common clinical sign in clinical medicine. How did Rudolf Virchow, contributed to, and he also described the cell theory in medicine. He is the first one to describe and is a pioneer in cellular pathology, exactly like Charcot was a pioneer in anatomical pathology, Charcot, and also Rudolf Virchow, pioneer in the cell theory, and also Professor, of course, Pasteur. And Pasteur is the father of modern microbiology. He is the pioneer of the germ theory, Professor Pasteur, and of course to him is attributed pasteurization of milk. So Louis Pasteur is a very famous French physician and microbiologist, and is the pioneer of microbiology. And after him also Robert Koch in Germany, and Koch described the Koch's bacillus, tubercle bacillus. How did Robert Koch contributed to the germ theory and to microbiology after Louis Pasteur? And this is all contributions of those famous physicians in the history. Also Trousseau, who described Trousseau syndrome, and who described Trousseau sign in tetany, hypocalcemic tetany. So, and doctors like Alzheimer, who described Alzheimer's dementia, Cushing, who described Cushing disease, Addison, who described Addison's disease, and Graves, who described Graves' disease in the thyroid. How all of those physicians in the past and in the middle era, في العصور الوسطى, and coming to the contemporary medicine, how they contributed to the medicine and to medical practice. That's very important. ازاي هم اكتشفوا اكتشافاتهم واخترعوا اختراعاتهم ووصفوا, and they describe the different syndromes and signs in medicines which carry their eponyms, يعني that is carrying their names. We call it eponym. So they described clinical signs, and they described also clinical syndromes by their names, which still carry their names still now in the clinical textbooks. The importance of studying history of medicine is to teach students how to be creative and how to think and how to understand and how to describe and how to be a good understanding doctor. That's why I was also calling for teaching history of medicine, تاريخ الطب لطلبة الطب. I will continue talking about this issue in my future speeches, inshallah. Thank you, Professor Dr. Tarek Ali.